get ready to raise some hell. Harry, all the magic in the world can't help. And Spider-Man, good luck getting out of this web. Because Universal's about to drop health insurance for part-timers. And Betsy McCaughey, who I tell you, I know I sing this woman's praise all the time. You think, what's the deal? She saw this coming. She predicted it on this show. You folks just keep merrily wandering by. Betsy, not
It's a sad story. It's a sad story, but
they're saying they just can't afford it.
That's right. They can't afford it. And the reason is this. The law says that employers with 50 or more full-time workers have to provide the government-mandated essential benefit package. It adds about $1.79 an hour to the cost of a full-time worker. But the law doesn't say you have to provide it for part-time workers. And Universal in the past has provided very modestly priced minimum mini-med plans, very modest health insurance. Well, that's against the law starting in 2014.
All right, but I heard that and heard what you're saying now, and then I remembered what the president said back at the time pitching this. And, of course, you remember this famous promise. Listen to this.
If you like your health care plan, you can keep your health care plan. If you like your doctor, you like your plan, you can keep your doctor, you can keep your plan. If you like your health care plan, you'll be able to keep your health care plan. Period. No one will take it away. No.
You oughta.
Well,
What the heck?
anybody who
That
read
didn't happen.
George Orwell in 1984 would have known that is untrue.
But obviously, maybe let's give him the benefit of that he didn't foresee this coming. What did you see coming that would make a decision like Universal's and so many others, they're just the latest, say no mas?
Because there is no tooth fairy, Neil. When the government requires... Right. I knew it was going to shock you. When the government requires insurance companies to offer more and more to cover kids till they're 26, to eliminate annual caps on coverage, lifetime caps, to make preventive care...
You have to pay for this.
You have to pay for all of it, right. And the government says employers can only provide the essential benefit package. It's one size fits all. And Universal...
So for part-time workers, what is this going to mean? Because others are facing the same quandary.
That's right. Well, they're going to be dumped into Medicaid, or they'll have to make their way to the state insurance exchange and buy the one-size-fits-all government-designed plan.
Which is very pricey.
It's very pricey. Some people will be eligible for subsidies, but the fact is there's no choice. Now, Medicaid, which many of these part-timers will probably be put into, that is not a pretty picture because Medicaid coverage is perilous. For example, surgery patients on Medicaid are 50% more likely to die after surgery than surgery patients on private insurance. In fact, it's even riskier to be on Medicaid than to have no insurance at all. That's straight from the Annals of Internal Medicine.
Sounds like the president, though, is kind of getting his way in the end. That it wasn't about a single-payer system, but in the end, it's going to be Uncle Sam and only Uncle Sam. The way we're going.
It could be. Now, I'm very disappointed to see what Rick Scott, the governor of Florida, has done.
Many people say he just caved.
He did. Well, let's face it. For politicians, Medicaid is a verb. It means spending, spending, spending on more benefits in the hopes that the federal government will pick up the tab.
Well, what did he decide in the case of setting up his exchange?
He said he's going to suggest to the legislature that they expand Medicaid as the law recommends, right? Because the federal government has promised to pay 100% for 3 years and 90% afterwards. But the federal government generally breaks its promises.
Having said that, though, I think there was also this notion, it was the same thing with Governor Brewer in Arizona, right? They didn't want to cede all control to the federal government, so they felt that by partly
That was more with the exchange.
I understand. Right. I understand. Actually, I don't, but I'm trying to pretend I do. That better have some control than no control.
Here's the real glitch, which Jan Brewer from Arizona pointed out, that legal immigrants evidently are eligible to go to the exchanges regardless of their income and get subsidized health insurance up to, they can earn almost $100,000 a year, household income. But citizens who earn below 133% of poverty would have to be on Medicaid. And she said, if I don't expand Medicaid, some of my Arizona residents will be uncovered because they'll be between 100% of Medicaid, what it is now, and 133%.
Yeah, but she and a lot of us were all dead set against this. Now, one of the latest holdouts, we don't know yet, and the light material is Chris Christie in New Jersey, but that there seems to be something that ultimately pushes them to be...
Politicians sell out because they want the federal dollars to pay for the benefits. And they
well, that assumes that not becoming part of this means you pay a lot more.
No, it means there'll be fewer benefits for some people in the state, but what they, they're short-sighted. They're ignoring the fact that the state is going to go bankrupt when the federal government pulls back on its promise and Medicaid has been vastly expanded and state taxpayers have to pick up the bill for all these new enrollees.
So more surprises to come, more
benefits.
universals to come, more stuff to get you sick to come.
That's right.
Okay. On that happy note, Betsy, thank you.
But forget what I said about the tooth fairy.
Yeah, I hope my kids watch the show. It was a joke, kids. Still coming. Meanwhile, coming up,